Dear friends, welcome to Know Thyself YouTube channel. Good morning. Hope you are all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos published in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others around the internet. In the last episode of Know Your Mind segment, we spoke about the diagnosis of resonance disorder. In this episode, we analyze the treatment of resonance disorder. Treatment of resonance disorder consists in putting into practice the patient-specific treatment plan prepared by the speech-language pathologist. Treatment of resonance disorder is designed, firstly, to capitalize on strengths and address weaknesses related to the underlying structures and functions that affect resonance and articulation. Secondly, to facilitate activities and participation by helping the patient to acquire new skills and strategies. And thirdly, to modify contextual factors to reduce barriers and enhance facilitators of successful communication and participation, including identification and use of appropriate accommodations. Thus, the goal of treatment is to achieve improved resonance to facilitate functional oral communication. For the treatment of resonance disorder, the speech-language pathologist may suggest one or more of the following approaches or procedures: surgical management, prosthetic management, pharmacologic management, and behavioral speech therapy. We briefly consider each of these. First, surgical management. Resonance disorders involving hypernasal speech can be treated with the help of palate-based surgeries such as double opposing C-plasty, soft palate elongation, midline incision, and intravelar veloplasty. These surgeries help to repair the primary muscle and reconstruct the palate to create a favorable anatomy for proper mouth-throat functioning. Similarly, throat-based surgery such as pharyngeal flap to facilitate nasal breathing and proper production of nasal sounds, and sphincter pharyngoplasty to reduce the diameter of the veropharyngeal port. Likewise, augmentation, which consists in fat grafting to fill in small velopharyngeal gaps, leading to improvement of hypernasal speech. Either one or more of these surgeries can be used to treat hypernasality. Resonance disorder with hyponasal speech can be treated by surgical procedures to correct anatomical sources of obstruction. These surgical procedures include tonsillectomy, that is, removal of enlarged tonsils, removal of nasal polyps, septoplasty, that is, surgery to correct a deviated septum, surgical removal of tissue or bone of the nasal passage to correct nasal passage blockage, and surgical reconstruction to enlarge narrow nasal cavity so as to facilitate nasal breathing and to avoid open mouth breathing. Second, prosthetic management. Though prosthetic management may not be helpful in cases where resonance disorder is anatomically based, it can be used to correct resonance problems that are neurologically based. It is often used when surgical options are not recommended for a patient or whether surgery has not completely resolved the resonance problem, thereby to facilitate optimal speech and swallowing function. Prosthetic management may include, firstly, placing of a palatal obstructor to block an oronasal fistula, that is, a hole connecting the mouth and the nose. Secondly, placing a speech bulb to block the velopharynx when there is a velopharyngeal infection. Thirdly, placing a palate lift to elevate the velum when there is poor velar mobility. And fourth, placing a nasal obstructor used either for individual with a velopharyngeal infection or velopharyngeal incompetency to decrease airflow during speech. Besides, it can also be used in cases when the using of a palatal lift is not an option. Pharmacologic management. Pharmacologic management is taken recourse to when there is swelling or inflammation in the nasal cavity due to allergies or other irritants leading to hyponasal resonance. Medications include antihistamines and steroids delivered via nasal sprays or oral medication. Fourth, behavioral speech therapy. Though behavioral speech therapy cannot correct resonance disorders that are due to structural causes, it can be used in cases where the abnormal resonance is due to causes other than structural. Behavioral speech therapy can be used, firstly, to treat patients who suffer from phoneme-specific nasal air emission or phoneme-specific hypernasality. Secondly, to treat compulsory misarticulations, as in cases of patients with a history of cleft palate. Third, to treat patients who suffer from post-operative hypernasality. Fourth, to treat hypernasality that occurs due to muscle weakness and to treat articulation errors secondary to apraxia of speech, leading to velum articulating more accurately. Understanding the causes of resonance disorder, getting diagnosis on time, and following the specific treatment plan suggested for you by the speech language pathologist on a regular basis, you can manage your resonance disorder reasonably well. In the next episode, we will begin the analysis of the process of learning. Thank you for watching this video. Stay blessed until we see you again with another video.